Okay, I want to thank Dr. Sherwood and Dr. Scott. He was the statistician, and Dr. Sherwood is our full-time faculty researcher. Because I am a clinical nurse specialist by my doctorate degree, I chose not to get a nurse practitioner degree. Nope. Which way did I go? Oh. The purpose of my study was to implement and evaluate a clinical judgment model for creating patient care plans and in building nursing students' confidence and critical thinking skills. Let's think back to nursing school and care plans. You know, I was always a firm believer of concept maps. Concept maps are where you design and implement. It's not like we go into a patient's room and say, oh my gosh, you're in pain. I'm going to forget about the fact that you haven't moved your bowels in 5 days. So again, I think we need to look at holistic patient care. The goal, though, was to hopefully build the students' level of confidence in planning the care and in building their clinical judgment to develop a care plan that's a little reflective of higher level cognitive thinking. We know the implications is, this is it was a three-phase qualitative study, and it had significance because we know the Association of Colleges of Nursing in their baccalaureate education for professional practice stress clinical reasoning and critical thinking, and we know the ever-changing healthcare environment. We also know that NCLEX will change in April of 2023. It's going to be case-based study, so it's going to reflect clinical judgment methods for critical thinking and decision-making. We know a change is necessary in kind of coming up with some innovative teaching strategies. The implications, we know the clinical judgment model enhances critical thinking by leading a student through steps of identifying patient cues, relevant data, analyzing those cues, and then identifying inferences, like what could it be? Prioritizing a hypothesis. Hypothesis was a hard word for our faculty to get on board with. Generating solutions and actions, and finally evaluating outcomes. We know critical thinking is an essential component of clinical judgment, yet current methods to teach nursing clinical judgment have not really been developed. Nursing diagnoses are going away, folks, so you know it's changing to clinical judgment model. The overview of my research study is the first phase was a Qualtrics survey that I provided to nursing students to complete prior to starting their junior med-surg clinical spring of 2021. The survey was 7 Likert-type items, each asking the respondent to indicate their level of confidence and their ability to address each item for planning and implementing care. The survey instrument items, by the way, I have this in my references, the survey, but we had the student analyze the information, making connections among clinical data, determining relevant data from the clinical exam, setting priorities in patient needs, selecting appropriate resources to address patient needs, applying relevant knowledge to identify interventions, and effectively assessing whether goals are met. Our junior med-surg course, we have the students go the night before to research. This kind of became a problem during the pandemic. So how are we going to get these students to go in and meet their patient and begin to identify, look at these different things on their care plan form? The phase 2, though, looked at that same cohort of students after introduction of this model and the care plan form itself. They were provided an instructional 11-minute introductory video by myself. I presented it to all the students, and we presented the video in the didactic portion of the course, which was an important component. The same Qualtrics survey was completed post-care plan use, and it was also used. The survey was asked for the faculty and teaching assistants to also look at it, to answer it. Phase 3 included the statistical analysis, looking at your confidence level comparison and pre and post scores. As we know, we use the clinical judgment model steps as identified by Tanner. recognizing the cues, analyzing cues, prioritizing hypotheses, generating solutions, taking actions, evaluating outcomes. Now, for the study purpose care plan, I combined steps 4 and 5. To this day, as we use the clinical judgment model care plan form at our university, students still have a hard time with steps 4 and 5, and we'll talk about that in a little bit. The care plan form that I used actually was this. The first box, I had it set up like boxes. The first box was patient cues and relevant data. I gave them hints to put subjective, objective information. The second box was analyze cues, identify inferences about the patient cues. I asked the students to list a minimum of 3 and a possibility of 5. Then the third box was prioritizing their hypotheses, where we looked at the patient healthcare needs. Step 4 was to generate solutions and actions, and this was the little hint. This may involve an assessment and/or an intervention, and we wanted the students to put the rationale for why they wanted to do that actual intervention. Step 5 was evaluate the outcome and include whether the solutions solved the hypotheses. The participants, there was 29 traditional junior students. Here's the sad thing, guys. There was 91 students total in this class. And I'll tell you a little bit when I talk about my limitations, what happened and why there was not more participation. 19 students, though, completed both surveys. Open-ended questions regarding the clinical judgment model care plan form and instructions were posed to both students and faculty teaching assistants that were in the course and who graded these care plans. We had maybe 15, 20 points for the care plan assignments. The results showed that the student survey showed an improvement in overall confidence composites. There was an increase in total confidence from 4.61 to 5.13, noting a trend for this difference to be statistically significant. Despite a very low sample size, significant benefits were noted from this form, providing an educational intervention regarding the clinical judgment model. There was a statistically significant increase in students' ability to select appropriate resources to address patient needs, and there was a statistically significant increase in the students' ability to apply relevant knowledge to identify the interventions that were needed for the patient. This profile plot shows the testing mean difference on the overall score, and it did show the increase. My results say that a clinical judgment model care plan form showed potential to foster increased analysis for improved decision-making and planning patient care. As I stated early, the research we know as nursing educators, novice nurses have trouble with prioritizing. They have trouble with making that initial decision based on the cues that they see. The limitations, the study took place during the pandemic, and thus no in-person class participation. I felt that there would be greater student participation if the survey was administered in the didactic portion of the med-surg course. I made the mistake of I worked collaboratively with the faculty, the primary faculty, didactic faculty, but we should have asked the students to actually do the survey in the class because it was 7 questions. But both students and faculty would benefit from like an exemplar provided to understand exactly what information should go into each of the 6 domains, and definitions of each of the domains are needed for further clarification and care plan development. Despite a low sample size, significant benefits from providing an educational intervention regarding the clinical judgment model were seen. Instructional efforts should be integrated into clinical orientation sessions for both faculty and students. I want to talk a little bit about faculty collaboration. As a med-surg faculty, we had about 6 Zoom sessions, and we worked together as didactic and clinical faculty was held, and then we established and agreed upon a semi-standard clinical judgment model care plan form to utilize across the undergraduate med-surg nursing courses to strengthen clinical judgment starting first sophomore clinical experience. I teach sophomores first semester this year, and we are using this form. Again, the guidance, more feedback was that guidance and introduction was necessary to the faculty. This is a copy of the form we're using now, and whether you set it up in boxes or however you use it, it's a 2-page form. And again, I think it helps students think about, what matters most when you meet this patient. And in each of the steps, we have prompts to help them, because these are all new terms for faculty. And in 2, analyze cues. Well, what could it mean? And then prioritize hypotheses. Where do I start? Again, if you look at analyze cues, talk to your patient. I know my little sophomores, they have a hard time with that. They're real nervous because they're 19 years old starting this profession. The fourth step was I separated generate solutions, what can I do, versus taking action is what I will do. So again, it helps students figure it out. Students have a hard time too, I want to state that actions are interventions. We use interventions for years and years and years in nursing, but actions are our interventions. And then of course, evaluate outcomes, what will happen. Again, I want to show you, before I put up the question box, I'll show you my references. And in the references, I'd be willing to assist or provide this. I'm trying to get this published, but as we all know in nursing, publishing a manuscript, they don't want it because there's not that many of us. My sample size was small. I got turned down. I did all this work, pages and pages, and I was turned down from the Journal of Nursing Education, which was kind of a disappointment. So I don't really have this published, but I'm sure that I would be more than willing to share it with you folks, because we know the nursing process is still there, but guess what? We need to really change our tunes to get ready. And we started this, I told you, in 2020. So I'm ready and open for questions. If anybody has any questions about my care plan form?